Okay. Maybe everybody's sleeping this morning. Um, I want to get started on time because I want to, think I'm going to, we don't have much material to cover today. So I'm going to try and do that in the first hour. And then or first, I don't know, 45 minutes. And then I'd like to spend some time going, I want to use the kind of, want to use the second hour and go through the study guide and do some review. Okay. How does that sound?
That sounds good. Thank you.
Yeah. Yeah. Okay, well, I'm going to get started. So let's see. Let me share my screen. What what questions do you guys have? We're in week 9. Okay, I sent out emails yesterday. I tried to do a little road map for you guys for the rest of the term. I don't know if you read that. If you did, was it helpful? Hi, Terry. Was that roadmap helpful? Did you guys take a look at it?
Yeah, I looked at it. I thought it was very helpful. Thank you.
You're welcome. Um, what do we got going for this week? Let's see. Let me pull up our modules. Okay. You guys put your names in the chat for attendance, please. That would be great. Um, so, pardon me. As I said, there's not a lot of material to cover this week. In fact, chapter 14 in your fundamentals book, the cultural competence, we've already covered that, so we don't have to cover that. I want to cover emergency shock, trauma, and then I want to cover a little bit more in ethics, which is in chapter 3. Uh, and then I want to go through the study guide. Okay, so I know I sent you guys a study guide, and the 2 reviews this upcoming week, Friday and Sunday, I believe. Was it Friday and Sunday? I think it was Friday and Sunday. Sent you the study guide last night, so we'll pull that up in a little bit here and we'll start to review it. How's that? Because I know it's hard for a lot of you guys to get to review sessions, so I thought I'd take advantage of using part of class to uh, start to look at the study guide. Okay, and the study guide is an excellent representation of what you need to know for the exam. Okay, we took a lot of time to do it. We pulled information from your notes, your weekly notes that we send you. We pulled information from the book. Um, Obviously, we've taken a look at the exam, and so the study guide is a really good starting point for you guys. Okay, if you don't understand what's in the study guide, go back to your readings, right? Go back to your notes and gather more information. Okay, but start with the study guide. Okay, if you have a good understanding of the study guide, you're going to do fine on the exam. I promise you. Okay. What questions do you guys have going into week 9? So this is our last week of content, obviously, because next week is your exam, and then you jump right into your HESI. Okay, and is it this week? I'm going to share my screen here. Don't forget to put your names in the chat. Okay, is it this week? Week 9. Okay, so your HESI prep assignment is due on Sunday. Okay, so um, have you all been working on that as we've been going through the weeks? Where are you at with your HESI prep? Where are you guys with your HESI prep?
I definitely need to work on mine.
Okay. Okay. Because you guys go right from exam 3 and the next week is HESI. We'll do I need to talk to Dr. Kershaw, but I plan on doing a HESI review probably at the end of week 10, right? So after the exams are done, maybe that weekend I'll do a HESI prep. Okay. But the reason you have your HESI prep assignment is this is after looking at the last 2 terms of HESIs, these are topics that were covered on the HESI. I don't know what the questions are. It's kind of like an NCLEX exam where they pull from a huge bank of questions. So I have no idea what the questions are, but I do know what the topics are that are covered. Okay. And then you have your NCLEX. Okay. And then your case study. Okay. Several of you have already done the case study. So, okay. Any questions? Then next week are you guys all working on your vulnerable populations project? Because it's due next, it's a research project. So if you haven't started it, you need to get going on that. Okay. So let's go to, does anybody have any questions? Oh, where's my book? Okay. I want to cover chapter 3 first. I'm going to go. Okay, there are a couple of things from this chapter that I wanted to cover. All right, that is in your study guide. Okay, so I think this is the second week that parts of this chapter have been assigned. But this week was a little bit different information. Okay, it was pages 35 and 41. So I want to skip to that. Okay. And what I wanted to cover here was this box right here on page, where are we at with page 35? Okay. And this is part of the ethics of nursing care. Okay. What do clients expect during their hospital stay? Okay. This has to do with partnerships with the patient care partnership. Okay. So obviously, if you're in the hospital, the team, the staff is committed to working with you and your family to meet your healthcare needs. Right? Our goal is that your family to have the same kind of care and attention you would want from families and ourselves, from our families and ourselves. Okay? So these are some expectations of how clients should be treated. Okay? What do you expect? What do patients expect? And it's important for us to know this too. What kinds of things, before we even read this list, what kinds of things might we have to take into account with each patient? I mean, these are all kind of common expectations, but what specifically with individuals do we have to consider before we come up with our patient care plan? I'm not sure who needs to mute. What kinds of things do we have to consider?
Their culture.
Culture, right. What do we need to consider with their culture?
Like if they like a Jehovah Witness, like I know they don't accept like blood. So if something was to happen, like what would they like want like to happen in their care plan as far as like,
Right.
like if they needed blood?
What about food? What about different kinds of foods,
Yeah.
right?
Muslims, they don't eat pork and things like that. Certain foods they don't eat.
For a
And then
particular, right? For a particular culture, right? So we have to consider food preferences. We have to consider what their culture is, what their beliefs are, what their values are. That all has to be part of the assessment, right? What else is important? What about pain management? Is that important?
yes,
And do certain cultures have different expectations?
yes.
Mhm. What else do we need to consider? What about family members? You know, in some cultures, they want all the family in the room when the health team is in there, right? So we need to consider that. Okay, obviously what the patients are expecting, once we assess what individual needs the patient might need based on their culture, high quality hospital care, clean and safe environment. This is what we would expect, that the team is engaged in your care, right? That you're informed. You know, if you're competent enough to make your own decisions about being part of your care plan. Communication is important. Are people are taken care of? Are you being open with them about treatment plans and options? What's the end result? How long do they expect to be in the hospital? Right? Who's going to make your decisions when you can't? Okay. Do they have a medical power of attorney, or those are things you need to assess, right? Ensuring that you're protecting their privacy. They need a comfort level with that. And then we all know that working in the clinical setting, that discharge planning starts when?
On a mission.
Right. 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 So we're constantly planning for discharge. All right. Who do we have to get involved? Are there outside agencies that need to be involved with medical equipment or oxygen or therapies or follow-up appointments? Okay. But the most important thing to consider, not only with this list, is what individual needs patient, what we need to do in our initial assessment of how we're going to individualize our care to these patients. Okay. The other part I want to cover with another part I want to cover you, this is not listed in your reading, but it needs to be, is page 38. Okay, with regards to HIPAA. Okay, there's a couple of questions about HIPAA on the exam. Okay, so even though this wasn't in your reading, I do want to cover it. Okay, what is HIPAA? What's HIPAA?
It gives you like the regulations on, you know, like safety for or security for medical records. It gives you like the rules and policies for like your right as a patient to your medical care and information and things like that.
Yeah, it's the right to have your privacy, right, with your medical records, right? So it's regulations regarding patient privacy and electronic medical records.
I have a question on that because I was doing some NCLEX questions, and one of the questions was saying like if a prisoner was brought into the hospital by the guards or something like that because they got sick at prison, and they wanted to the prisoners, the guard police officer wanted to know if the prisoner had taken like some type of substance or something. And well, it was two questions like that, similar to that. I don't know them exactly, but one of them was saying that the prisoners have the right, according to HIPAA, where a nurse can give them the information. And then the other one, maybe it was police officer, something like that. But the other one was saying that they have to go through certain protocols. So can you, if you know what I'm talking about, can you clarify that for me? Because I'm confused.
Well, I don't know the exact policy from prisons to hospitals, but HIPAA, they have to, you know, I think it would be like going from, you always have to sign a consent, right? With HIPAA. So I would think that the prisoner would have to sign a consent to turn his medical records over to the hospital. I mean, that's the prisoners are protected with HIPAA as well. Right?
Okay, I just, because one question, I remember those questions, but one was saying that the police officer, the guard had the right, so the nurse could give them the records, and the other one was saying that they have to go through protocol. I probably am mixing them up because it was
the protocol. The protocol is consent. You know, every time you go to a doctor's office, you sign HIPAA paperwork. It's always in the back of the paperwork you fill out. You're consenting to us, wherever you are, providing your medical records to whoever needs it. Right? And we did this in the schools all the time. With the kid, I just couldn't call a physician to get information. Everybody needed signatures and just consent for me, for the doctor to provide any information for me. So the same would apply to the prison population, right? Just because they're a prisoner going into a inpatient facility for whatever care they need doesn't mean that they don't have HIPAA rights. They do. Okay.
All right. Thank you.
Yeah. And we know that lots of information is passed back and forth, right? We're passed back and forth from doctors to hospitals, right? So this Health Insurance Portability and Accountability Act, right? It protects the patient and their information, and they get to choose who sees it and who doesn't, right? So HIPAA rules also give patients a right to the information in their medical records and the right to amend any incorrect or erroneous information, right? We definitely know part of our code of ethics for nurses is privacy and confidentiality. Would you all agree with that? That's one of our foundations, right? Patient information has always been part of the nurses' ethical code, physicians and healthcare facilities, right? And then new rules have simply increased the awareness, okay, for confidentiality. And medical records and flow sheets must be secured and not left where they can be viewed by others, right? You can't publicly display information, okay, with patient data. I mean, if you walk onto units, you have big whiteboards, right, that usually give your census, your patients, but they shouldn't be providing other information that visitors or patients that maybe walk in the halls can see, right? We also, as nurses, have to be careful with what's printed, right? Leaving things on the computer, leaving papers all over the nurses' station, right? And so Tara, here, patients must sign a specific release form if they want information to be sent to another agency, doctor, insurance company. Okay. So we need to know about HIPAA. So let's look at this box. All right, here's the rights provided by HIPAA for every patient. Okay, it covers 6 patient rights. Okay, we need to know these. Okay, consent. Right, so the patient must give written consent that says the patient agrees to allow the provider to use and disclose the information for treatment or for payment or for operations, right? And that's always on a consent form. So we need consent. Notice. Okay. The providers or whoever that might be, their obligations are outlined regarding the privacy of the patient's healthcare information. Right, and it includes the 6 patient rights and responsibilities of the provider. It also tells you how the patient health information is going to be protected, how to file a complaint if patient's rights are violated. Okay, and then patients also have the right to access. They have the right to access to inspect any of their medical records for accuracy or inaccuracy. They also have the right to amend, right? Amend their record for purposes of accuracy. And then accountability. Okay, providers are held accountable for how patients' medical information is handled. And then restriction. Okay, patients have the right and can request that their doctor or provider restrict the use of disclosure of information. Okay, but with this last one, the provider does not have to grant the request. Hopefully they will. Okay. So let's know about those rights for HIPAA. Okay. Then the last part I wanted to cover was here, malpractice. You're going to be asked about malpractice. Okay. I think that was the other, yeah, malpractice. What are the, what is malpractice? Malpractice, and what needs to, hey, it starts here. Okay. There's a couple of terms we need to understand. Okay. What is negligence? Okay, that's one term we need to understand. Okay, so negligence is failing to meet the standard of care. Failing to do something that is reasonable and prudent. Okay, and prudent, what does prudent mean? Sensible and careful. Okay, so you're failing to meet the standard of care, and we all operate under nursing standards of care. Okay. Failing to meet the standard of care, failing to do something reasonable, a reasonable person would do, or something a reasonable person would not do. That's negligence. Okay. Malpractice is negligence by a professional person. Okay. All right, so that person is not acting in accordance with our professional standards of care and is not making reasonable or prudent judgments. Okay. In nursing malpractice, a reasonable and prudent person is similarly, we have to be educated, licensed, and experienced. Right? So here's an example. An example of nursing malpractice would be if a nurse did not check the patient's vital signs, or a condition after surgery, there was a hemorrhage and the patient went into shock and died. And here's what I want you to understand. How do you prove malpractice? there has to be 4 elements. And this is in this little box down here. Okay? Duty, breach of duty, causation, and injury. Even if one of these 4 elements were not present, the nurse is not guilty of malpractice. So everything has to be met. All 4 elements need to be met. Okay? So for example, if a nurse made a clinical error that did not result in harm to the patient, the event would be considered, not be considered malpractice. Okay, because it didn't meet that one of the 4. However, it would be a deviation from the standard of care, right? And you may be disciplined by your employer, licensing board. Okay, so we'll talk about those elements of malpractice that must be met. Okay. So duty. So this is our responsibility. We have a duty to provide due care. Okay. Right? Appropriate care, competent care. Nurse has a duty to monitor, example, nurse has a duty to monitor the condition of the patient for who they're caring. That's our duty. Okay. Breach of duty. Failure to use due care. Okay, nurse fails to check the vital signs of a patient after surgery, or the nurse begins CPR on a patient who is a DNR. That's a breach. And then causation. What does that mean? That the injury, that the action or inaction caused harm. Okay. So there has to be a link between breach of duty and the injury. For example, the nurse's failure to check a patient's condition led to the undetected loss of blood and caused a patient's death. Okay. Okay, and then the actual injury or damages. That there's actual harm that results from the negligence. And that could be a physical harm, emotional harm, financial harm, pain and suffering, loss of the ability to continue a job, physical or emotional disability, extended hospitalization because of the injury. Okay. So does everybody have an understanding of what the 4 elements that every one of these needs to be met? Okay. So I'm on page 41. So with 3 things we just covered that you need to know. Page 41, the elements of malpractice. Page 38, HIPAA. Okay. And then page 35, are expectations. And I don't just mean these general lists. Let's think about the individual assessment we have to do at the beginning. Okay, or considering culture, ethics. Okay, you don't need to memorize, well, Native Americans prefer this and Hispanics prefer this. I just want you to know that we have to do an assessment of what are different cultures and beliefs that we need to take into consideration alongside this list. Okay. Okay, let's go to chapter 45. Anybody done any reading? Do we know what chapter 45 is? Okay, what do we need to know here? Okay, we need to know, I think we go up to maybe 1053, so we're starting on 1047. Okay, caring of patients with emergent conditions, trauma and shock. Okay, so what are the things we need to know? Here's some excellent terminology. If you need to brush up on your terminology for patients with emergency situations, shock, trauma. Okay. Okay, want to cover the first part. And the parts I have highlighted are that you're going to get asked about this on the exam. So, prevention of accidents. Okay, what do we need to know for home safety? Okay, accidents in the home and community rank the sixth leading cause of death. Okay, people younger than 5 and older than 65 are the principal victims of fatal incidents that happen in the home. Okay, attention to home safety for the very young and the very old is extremely important. Okay, so let's go through some of this, because remember, part of your role as a community nurse is teaching. Okay, and a big part of your role is primary teaching, right? Which is prevention of something before it happens, right? So let's go through this list. Home safety. I'm not going to read every bullet, but I'm just going to go through the sections. What do we need to know about home safety in the kitchen? What do we need to know for home safety in storage areas? These are the areas we need to consider. Okay, your living room. And a lot of this is, most of this is common sense, right? Same with the furnace. Do we get our furnace cleaned or checked every year? That's important. Your bathroom. These are good teaching tools. Obviously, store medications out of kids' reach. Okay, stairways, general areas. Especially in general areas, you have your smoke and carbon monoxide alarms. And also candles. Make sure candles are away from flammable materials. Never leave a lit candle unattended. Okay. Again, this is common sense, but common sense to you and I, but a patient who has low literacy or language barriers may not understand this. And you have to go through this with them. Okay, so please know what home safety tips are. And then what about highway safety? Okay, so you have home safety, highway safety, and water safety. Um, 2 million are injured in motor vehicle accidents every year. Improper driving is responsible for 90% of all accidents. Potentially influenced by alcohol, drugs, distractions, fatigue, speed, emotional instability. So part of our teaching, our primary teaching, preventing things before they happen, can be seatbelt safety, discouraging cell phones, motor vehicle crashes are the leading cause of death for Americans in the first 3 decades of life. So 30 and under. And what about those adolescents that are learning how to drive? Seat belts, seatbelt safety, following the laws, speed limits, stop signs, school zones, and then water safety. Big problem, right? Safe swimming areas, supervising kids, making sure that the water's deep enough if kids are people are diving in. And the rule of thumb is to never swim alone. And obviously don't swim beyond what you can, your distance of getting back to where you started from. Interesting, every day about 10 people die of unintentional drownings. I'm going to highlight this right here. Highlight two things. Oops. So, when we're talking about water safety, let's say the victim of a diving injury, okay, preferably, how do we care for this person, right? They should not be removed from the water until emergent EMS arrives because of possible neck and spinal cord injuries, right? So bystanders should try to mobilize the head and neck, keeping the person's face out of the water, right? If victim is not breathing and rescue breathing cannot be performed in the water, you're going to have to take them out of the water and start your rescue breathing, right? Obviously, if there's no pulse, you start CPR. Right, so what do we need to know? Try and leave them in the water if they are breathing, right? And immobilize them. And then if they're not breathing or they don't have a pulse, then you got to pull them out and do CPR. If they are breathing, how do you position them once they're out of the water? Where do you position them?
On their side.
Why?
So if they have like fluids in their mouth, it can come out and help with airway.
Yep, and prevent aspiration. Right. Yep. Okay, so what do you guys know about what's the Good Samaritan law?
It's a law that protects you, like if you are aiding somebody that needs help, that keeps you from being like sued and things like that. But you got to practice within your scope of training.
Absolutely. Right. Yep. So it guards against liability, like Tasha just said, guards against liability as long as you are performing whatever acts you're performing in good faith. Right? Okay. Psychological and social emergencies. What do you do with the combative patient? And what might be going on? What do you do? Have anybody ever worked with a combative patient?
You don't you give eye contact and address them by their name,
Mm-hmm.
and you definitely want to stay by the door and watch for glaring
Mm-hmm.
and hyper alertness.
Mm-hmm. Okay, here's a list of what Terry just started. Establish eye contact. Use the person's name frequently. Try and explain who you are and what you're trying to do. Explain to them that you're concerned about them and the situation using a soft voice, right? Making sure the patient can understand what you're saying, right? And then this section also covers domestic and intimate partner violence. Okay. I'm going to skip through this. Emergency care. Okay. So what do we need to know? Okay, with emergency care, that could be rendered in different settings. Hospital, clinic, out in the community, on the highway. Okay. Triage, what's triage?
And it evaluating, the patient with your like ABCs, airway, breathing, circulation, things, that the assessment of the patient.
Mhm.
Like,
So
we go
you're
to the room
trying to
and-
prioritize, right? Triage is about prioritizing. I always think of triage in emergency situations or disaster situations. You're trying to prioritize. Okay. And yes, we're doing our ABCs, but we also add D and E. Okay, so as you're triaging and setting priorities, obviously A is airway, B is breathing, C is circulation, but D is an assessment of neurologic, the neural status. Okay, and then E is exposure. Okay. And what that means is that you need to get a visual of the body. Body should be exposed. So you get a visual to make sure you can see all the injuries. Okay. So then it goes through, I just need you to know those 5. Okay. That's it. I don't need, but I did highlight airway, breathing. Here it is right here. Okay. If you want a D&E, what does D&E mean? You guys know how to do a neurological assessment, right?
Mhm.
You know how to do an exposure assessment, right? Okay. So that's what I need. That's what I needed you to know is that yes, the assessment is ABC, but it's also D&E. And remember, in triaging, we're prioritizing. Okay, control of bleeding. What do we need to know about control of bleeding? I used to teach in the schools, oh my gosh, what's it called? Stop the bleed. Stop the bleed classes. And the one thing we need to remember, there's lots of specifics about control of bleeding, but what we really need to know is applying pressure directly over the wound is the most common intervention for bleeding. We're not going to worry about where the injury is. Is it a peripheral or I don't want you to worry about that. I just want you to know that control of bleeding, applying pressure. Okay. And then what do we want to know about neck and spine injuries? Right. We need to make the assumption that they have a neck or spine injury. Okay. Meaning what? We don't move them.
Keep them immobile.
Keep them immobile. Okay. So that's what I wanted you to know about emergencies. We don't need to go into that. Okay. So I've covered what I need you to know. Okay. Home safety, water safety, highway safety. Okay. How to triage. Okay. Questions? That's what I wanted to cover today. That was our content today. Anybody have any questions? Okay. Let's do, you want to pull up your study guides? Why don't you pull up your study guide? If everybody get my email about your HESIs. You all know when your HESIs is scheduled for? You should be getting double communication from your campus and from me. So make sure you get your HESI scheduled. I don't know if I have anybody in this class. Yeah, we're still waiting on Norfolk. Okay, so if you're from the Norfolk campus, we don't have a schedule just yet. Okay? But Columbus and Centerville do.
Wednesday.
Pardon me? Okay. Everybody have their study guide pulled up? Okay. So this covers weeks 7, 8, 9. I've already listed out all your readings for you. Okay. I'm adding in here 48. That was our HIPAA. Okay. 35 was your ethics of patient care. 38 was your HIPAA. 41 was what? What's page 41? We just covered it.
Was that chapter 45?
Nope, page 41.
Malpractice, I think.
Hang on. I'm just having a moment.
Malpractice.
Page 41. Oh, malpractice. Elements of malpractice. Okay. All right. Okay, so here's all your readings. Then we have our general information, same as last time. Number of questions, 75 minutes. What's best practice? To study for an exam or a HESI? Okay. Review your readings, your projects, discussions, review your weekly Zoom sessions. If you're in class the whole time or were paying attention, great. But if there were pockets that you weren't paying attention, go back and review those sections. Okay, try and attend review sessions. Okay. I hope you guys are doing your NCLEX practice questions from your student resources. I hope you're doing those. Those will be helpful. Okay, remember your ABCs, remember your ADPI, right? Remember your primary, secondary, tertiary levels of intervention, prevention, or interventions. Okay. This is not an all-inclusive study guide, I will say that, but it is an excellent study guide. Okay. You're going to have to, if you don't understand parts of it, go back to your readings, go back to your notes. Okay, so I've tried to break it up into sections that we have covered. So if you look at our readings, I've tried to take each of these topics and make a section for it in the study guide to try and organize it for you. Does that make sense? So the first section is sexually transmitted infections, chapter 41. Next section is infection prevention and control. Okay, so I've tried to organize it for you so it'll be a little bit easier. Okay, so what do we want to know? What kinds of things do we want to know? What particular sexually transmitted infections do I want you to know about? Okay, HIV. What do I want you to know about HIV? There's your 5 bullets. That's what I want you to know. Okay, so if you don't have to go back to the book and go through the other 15 of them. Okay, this is what I want you to know about HIV. Chlamydia, here's what I want you to know about chlamydia. Syphilis, herpes, HPV. I have to clean this section up. It's too much information in here. Really, what I want you to know about HPV is that there are 3 vaccinations, correct? Okay, that what's the age group? Girls as young as 9 years old. Where is it? Right here. I think I highlighted it. Right here. That's what I want you to know. Preteens, including boys and girls, ages 11 or 12, or can start at 9. Okay, that there's 3 vaccines. And then the other part I need you to know is, if you're, what about pap smears? Do we still want to recommend women have pap smears?
Yes.
Absolutely. Okay. Right here. Right, because from HPV, there's a higher risk of cancer. Right?
Mhm.
So that's what I need to clean this section up. There's too much information in here. Way too much information. So I just, the things I need you to know are 3 vaccines, the age in which you can get started, and that, yes, you should be continue to do pap smears for the risk of cancer. Okay. Okay, next section is infection prevention and control. And that was chapter, let's see. Sexually STDs was chapter 41 in your med-surg nursing. And then chapter 17. I guess I could put that in there, right? Hang on, chapter 41 in med-surg. Okay. Infection control was, did I just say chapter 17 in fundamentals? Is that what I just said? Can somebody look at the top?
Mhm.
Okay, I'll go
Yes,
back and look. I'll go back and look. That's all right. Yeah. Oh, and it's only pages 249 to 258. What do we need to know about infection prevention and control? Well, first we talk about hepatitis. Okay. If you were participating in the group projects last week, some of your peers did their project on hepatitis. Okay, so what is hepatitis? Right? What's hepatitis A? This is what I need you to know. What's A, what's B, and what's C? This is all right here. That's all I need you to know about hepatitis, right here. What are the differences? Okay. TB. What do we need to know about TB? This. Okay. Again, this is in chapter 17. Okay. Your infectious disease chapter. TB. I want you to know about smallpox. Here's what I need you to know about smallpox. Okay. What do you need to know about early rash? Pustular rash and scabs. And what about when scabs fall off? Okay. So again, I'm just trying to organize this for you. So under infectious diseases, we need to know hepatitis, TB, smallpox, early rash. I guess this could probably go. No, that's a separate one. Okay. And what do you do with scabs? When they fall off, what if they have no scabs? Okay. Okay, we just covered this. Foodborne illness and food safety. This is What did we just, this is in, hang on. We just covered this in, this would be chapter 45. Bear with me. Work in progress for me, since you guys haven't had study guides before. I'm putting this together the best I can. Okay, so this would be a new heading. It would be what we just covered. Chapter 45. Okay, chapter 45, care of patients with emergent, this is what we just covered, foodborne illness and safety. Okay. Water illness. Vector-borne illness. Nope, that's not, nope. Take that back right here. Let's not go in there, because this is all about, we're still in infectious diseases. Okay, so part of infectious diseases, you have foodborne illness. You could have a waterborne illness, and you could have a vector-borne illness. Okay, so for example, with vector-borne illness, there's 4 that I want you to know. Lyme, the most common, Lyme, Zika, Rocky Mountain spotted fever, and malaria. Okay. What do we need to know about disaster management? Okay, and what was disaster? Disaster was, where is our disaster man? Right here, chapter 44. In our Med-Surg book. Okay, so chapter 44. Hope you guys are taking notes. Is that an 8? Okay. Chapter 44 in your Med-Surg book. Is this helpful to go over this like this? Anybody?
Yes, it's very helpful.
Okay, so here's what you need to know with disaster. You have 1, 2, 3, 4, 5, 6, 8 bullet points. That's what you need to know. Okay. First bullet point is natural or man-made. Healthy people, a lot of this came from your notes in the week 7. How do you do a disaster kit? Okay. What are healthy people 2030 objectives? Okay. One objective, that's right there. What are some of their objectives? The one important one is focuses on increasing the proportion of crisis and emergency messaging. So communication to the public. Pull out the important parts of each bullet. Okay. What's the purpose of a mass casualty exercise? Right? To evaluate the response time. Who's the NRF? The National Response Framework. Who are they? They're the federal agency that steps in. What do they do? Okay. They support with transportation, housing, medical researches, search and rescue. Okay. So that's what we need to know about disaster. Post-op care. We talked about this last week. Right? What's the most important things for post-op care? Airway, breathing, ABCs, safety, pain. What are some complications? Right here. How do you do an assessment of a post-op patient? Then there's your score. How do you score your Aldred score? When you start to evaluate discharging them back to the unit or back to the floor. right? If they score below 10, they need to stay in the PACU longer. What's a common complication? Thrombophlebitis. Okay, cirrhosis. Talked about that last week. Again, go through what we talked about. Peripheral artery disease. Gives you a nice synopsis of what it is. CVI, same thing. Hypertension we covered last week. There were many more notes about hypertension in your week 8 notes, but I tried to pull out the important things that I wanted you to know, and they're summarized here. Okay. Type 1 and type 2 diabetes. Okay, goes through both here. Okay, type 2, type 1. Some symptoms. What's hypoglycemia? How do you treat it? What's hyperglycemia? Okay. Please know DKA. Just know what the signs of DKA are. Okay. Okay, another section we talked about was hospital-associated infections, contact precautions, airborne precautions. Okay, here's a couple of bullet points about those. Use proper hand hygiene, N95s, private rooms for airborne diseases or airborne illnesses, and what's contact precautions. Okay, we just covered HIPAA. Okay, what's HIPAA? And what's malpractice? Okay. Culture of religious influences in patient care. Okay, this goes back to our cultural competence. Certain religions only eat certain butchered meats, Jewish kosher meats, Muslims no pork. Okay, so I've already given you a couple of populations with some specific requests. Okay, what about smoking? Thinking culturally. For individual cultures, what are their beliefs around smoking? What are their beliefs around drug use, herbal medicine, nutrition, caffeine? These are all things that need to be considered. Alcohol, food preparation, reading materials. Okay. So that's how we break out the study guide. I've tried to, like I said, take our reading topics from the beginning. Let's go back up here. So we have a section on infection prevention and control, right? We have a section on STDs, section on disasters. Okay, post-op care. This is kind of the header, but all of this. And remember these, after the chapters, if it says COVID-19 and public health and doesn't have any books or I'm going to put here in the module, right? Because these were those reading pages in the module, right? Addressing chronic disease was the module. And there were none of those in week 9. Okay. So, what do you think? Manageable to have it organized?
this way? Yeah, it helps, but it's a lot.
Okay. Well, that's the intention. That's the intention. Okay. And I know in this is my first time teaching PM, but I know they didn't have study guides in past terms. So teaching in the RN program, we have study guides for every exam. So I find them to be helpful for the students, and we work hard developing them so that you use a study guide for studying. You use your notes for studying. You know, I would say start with the study guide, and then if you don't understand certain sections, please go back to your readings to gather more information. Okay. And then if after reviewing the study guide, go into a review session, there are still concepts or information that you don't understand, set up a time with me before the exam and we'll go through what you don't understand. All right. But you have to do your legwork first. Study, review, highlight on your study guide. Nope, I need more understanding on this. Just week 7 notes. Yes. Did I not do that? Okay. All right. Sorry. So anyways, anybody have any questions? Is this helpful?
Yes, it was very helpful.
We're almost to the finish line. We're almost to the finish line, guys. Gotta get there. Gotta get there.
You gonna post this recording today? Because I like to go over it again.
You bet. Yep. I mean, it's still, if you can get to a review session Friday or Sunday, come, please. But it just made sense to take some time, since we were limited. We didn't have that much material to cover to review the study guide. Okay. And look at all the time. So I don't know, with your extra time here, I'm all done. With your extra time here, maybe take the next half hour and sit and go through the study guide and start highlighting. Use this time to highlight, you know, got it, not a clue, need more information. Okay. And I'm still available for reviewing exams, 1 or 2, or, you know, I think, yeah, you guys have back-to-back exams. So I'm still available to review exams if you want.
Can I review?
Yeah, Morgan, send me some dates and times at the end of this week that you're available. Listen, I know what you guys can do for the next 40 minutes if you want. Work on your HESI prep, because this is it. There's no more content. So now go back and work on that, right? So I know there's some stuff that we haven't covered. I know there is, so you're going to have to do some legwork in the book, but I tried to cover the great majority of it. But maybe let's use the next 45 minutes to go through that. It's up to you guys how you want to use your time. But that aside, I don't want everybody Friday, Saturday, Sunday trying to fill in all those boxes. So maybe you could use the next 45 minutes as community study time. I don't know. All right, everybody pull up their attestation for week 9. And make sure all your names are in the chat. Okay, so complete your attestation and hit submit. You don't have to worry about that. No quizzes this week, so I would go back and work on your HESI prep assignment. That's what I would do. Because your HESI prep assignment is also going to give you some studying for your exam 3. It's all connected. All the dots are connected. Okay, then I'll send out the recording when it converts over on my computer. If I have any questions, I'll stay on for questions, but the gift of time. You guys can
Have a
certainly,
good day, Miss Marvel. Thank
you
you.
guys can certainly use it, right?